People don't understand that the Oregon Health Plan is Medicaid. Believe it or not,
Mm.
that's not widely understood.
Yeah, yeah. Hi, Chiao. Um, well, while people are still coming on, why don't we sort of take 15 seconds or so each and tell who we are and where we are and why we're interested. Chiao, you want to start? Oh, you're muted still.
As you can see, my name is Si Chow Chow. I'm a happily retired physician like Mike, but I'm not as diligent as Mike in doing things.
Okay. Let's see. Hannah, just tell us a little bit about you.
Hi, my name is Hannah Bishop. I live in Cottage Grove, Oregon, and yeah, I recently joined the Lane County chapter of HCAO and am excited to engage in some of these community conversations, as this kind of thing is sort of up my alley and in my wheelhouse. So, meaning like organizing conversations. And I used to be an instructor at the University of Oregon, so I've done a fair amount of teaching and giving presentations. So
All right.
happy to use my skills in that area for this cause.
Wow. Thank you. We
Wonderful.
need you. Amanda, just a little bit about you. 15 seconds.
Good evening. I'm Amanda. I'm here in Salem currently, but soon moving to Albany and work for our local community college, Lynn Benton. And I also am a proud member of Mid Valley Healthcare and also head up the younger adults group that we just recently started. A lot of Oregon State members, so I'm excited to kind of bring this information back to them. Thanks so much.
Thanks, Amanda. Wes.
Hi, good evening. It is Wes Brain, and I'm in Ashland, Oregon. I'm a retired firefighter EMT. I did that for 16 years. And then I had another second career at the university, Southern Oregon University, occupational health and safety, trying to bring some smart stuff to our staff and employees there. So great to be here. I've been supporting this forever, and it's really good to see us. I'm on the board of Healthcare for All Oregon. I should mention that also. Thank you.
Thanks. Mary Lou.
I'm Mary Lou Henrich, and I'm on the board of Healthcare for All Oregon and on the fundraising committee and a lot of other places. And I just got appointed to the Universal Health Plan Governing Board. So I'm one of the 9 people that will come up with the plan. So anyway, very excited to be here.
Great.
Great. Thanks, Charlie.
Charlie Swanson, Eugene, Oregon. I'm president of Healthcare for All Oregon Action, and also I'm a member of the Finance and Revenue Committee of the Universal Health Plan Governance Board.
Thanks. And Bruce.
I'm I'm actually a disabled vet, so I get my health care through the VA,
Yeah.
which makes me puts me in a unique position to be able to argue in favor of HCAO.
Mhm.
And I let me see. So I was a computer specialist for the state of Washington, several agencies for some time. I've on the activist side, I worked for with ROP for a while. I put together the ACLU Thurston County chapter when I lived in Olympia. I live now on in Tillamook County, but in the mountains, and so um, I've come on to help a little bit with websites, and I'm very interested in speaking also. And I've just started a North Coast chapter, which will consist of Tillamook County and Clatsop County.
Great.
So when I worked for the
Yay.
I worked for emergency management in Washington, and I knew most of the counties there. Now I've been in Oregon for 20 years, but I'm still I'm still like all this moving around,
Yeah.
It's very similar to Washington, but but different.
Thanks, Bruce. I'm Mike Huntington, a retired radiation oncologist. Got involved because of too many patients delaying care. They're so afraid of cost. Um, and so tonight, I just wanted to go where you want to go. We can look at the slides, ask questions about that, or try to answer them. We can talk about Social Security, a big event today regarding the judge stopping the Doge activities. We can talk about that if we want. But before we get there, I just want to go over norms for conversations briefly. And the reason is that crucial conversations, that is high emotions, high stakes, and opposing positions, can crop up without any warning. And so we need to be prepared for that and how to take care of each other if and when that happens. So here's can you see my conversation norms?
Yes.
Uh-huh.
Okay. So the main point is that the meetings are primarily to build relationships, and then only after that can we exchange information in a trusting way. So it means thoughtful communication, plan your comments, don't speak over someone else, and use the electronic hand raise, looking at reactions, and then raise your hand so we can see who's in line. And then before speaking, ponder the WAIT acronym. Why am I talking? And then make sure others have a chance to talk. Avoid demeaning words. Keep the mood upbeat. And then be alert for that crucial conversation. And then if we see we're in one, just step back and see where we agree and take care of each other. That's basically it. Where, where, where do we want to start? Slides, philosophy. I want to know what you want to talk about.
I would like everything, please.
Okay. Mary Lou?
Well, I think I haven't tried to put together a presentation using these slides. So I'm just a little nervous about the technical parts of kind of doing that. And then if I'm in a small group, I guess I use my computer, but I'm just not sure how, if I were going to say I'm going to have a house party and I would like to show some of these and let people kind of know more. What kind of equipment do I need to have, or where do I get some of that? Or, it's that kind of stuff that I'm mostly worried about.
Oh, thank you. Amanda?
Are you just asking what I'm interested in, Mike?
Yeah, what do you want to make sure we talk about tonight?
I would say I'm covering the slides and then the actually how we get assigned a speaking engagement.
Okay.
That would be important.
Hannah.
Yeah, I guess just kind of we did this last time, but it would be helpful to just take a look at the slides again and talk about kind of overarching, we don't need to go through them one by one, but sort of overarching, like what are the major sections that are included? It would help to have that sort of 30,000-foot view so I can think about what topics are available and on the table, because I'm sure different audiences are going to require or be best served by different topics. And so kind of knowing what we have content for, and then discussing, if we feel like it's complete or if there's other content we need, or, that I think that would be great.
Thanks. Charlie.
So this is kind of on a different topic, but I thought this would be a good group to bring it forward to. And it relates to the universal health plan that is going to be put in place, we hope, by the Universal Health Plan Governance Board. And so one of the things that the structures committee is working on, I don't think it's structures, but is having a public corporation rather than a state agency do this. And so among the things that is supposed to happen with this is the the components of the Universal Health Plan must be accountable and fully transparent to the public regarding information, decision-making, and management through meaningful public participation. And so one of the things that I would like people to be thinking about kind of as they're going along is how can we best assure meaningful public participation in this public corporation? And the reason I ask that is because if you look at the public corporations that we have, I would say mostly OHSU and SAFE. I think there's another one or two, but neither of them really have meaningful public participation in the decision making. And so, what and as we learned at the meeting on Thursday, the Universal Health Plan Governance Board meeting on Thursday, there's really no really ground rules for what it is meant by public corporation. I mean, there's a few, but not very many. And so as they're setting us up, they can set it up the way they want or the way we want them to. And so I would hopefully hope that people can start thinking about how could we best assure the possibility of meaningful public participation in these activities. So I'll just leave it at that.
Wow, a good thought. That could shape how we give talks and what slides we do show.
Mhm.
Oh, great. Let's see. Wes. He may be away. Mary Lou gave hers. Bruce, you gave all, didn't you? Said
Well,
all.
I seriously, so I've been kind of testing the waters and speaking to friends of mine and talking to them about what I was hoping to become a speaker for and what are their questions. And I have some friends that are very cooperatively tough. So one is an Intel retiree, and he asks questions like, I get very good insurance, he said, because I worked at Intel and they have a really great plan and it's excellent insurance. And so you're going to take my insurance away? What if it's not as good as theirs? And will there be options for insurance companies to pay for greater insurance above what is the plan for the whole state? So questions like that, I would like to be able to answer. Who appoints the corporation or board, the group that's running the insurance plan when it's running? I understand it's going to be separate from the state government, but who appoints those positions? And again, the input to that is a really important thing. So I agree with what was just asked for. And even more importantly, how far into, because Tom Sinka was,
Sinsick?
yeah, what you said,
Sinsick.
Sinsick was saying, when you're speaking, he said, be careful when you get questions that are too in-depth, don't go there because you'll be spending 5 minutes trying to answer questions, and those 5 minutes are being stolen from the many other people you could be bringing up with, during that time. So I'd like to speak a little bit about when do we just say, well, here's the website, go find out for yourself sort of answer, Okay.
Oh, let's see. Marisa Bell just joined us. Marisa Bell is a wonderful lady who is an international midwife and works closely is on the board of Mid Valley Healthcare Advocates. And she emceed the town hall that Mary Lou and Bruce Goldberg and
John.
John Santa. So, Marisa Bell, we've just been going around taking 15, 30 seconds to say, what would you most want to pull out of this meeting tonight regarding slides or how to give a talk or philosophy? You heard a little bit of comment since you came on. Why are you here?
Because you told me to come.
That's
And I'm
no fair.
afraid of you.
Marisa Bell and I went to Cuba together and saw a real healthcare system. But
No.
what else?
Seriously speaking, I mean, I taught college and I used to give talks for Johns Hopkins and stuff like that. So I mean, I can handle my situation, and I never speak in 30-second slots. Bad news. Um, but just to sort of reintegrate myself to the idea of inviting people to my house and listening to discussions on universal health care and, just in general, getting an idea. Um, I just actually I'm late because I was out and this lady said to me, "You do universal health care." And see, my concern is that don't they have that in Canada? Indeed, they do. And so she said, "Well, the Canadians sometimes come to the United States to get health care. So this isn't a good idea, right?" And I said,
Yeah.
"Okay, so the reality that you have to keep in mind is that will it start in God's perfection when we start it, or are we solving a huge problem? Did we have a perfect, unchangeable Social Security when we started? We did not. And we're still changing. And so, what we want to do is to change the situation in our state, hopefully, the country at some point. But for the time being, is it God's perfection? God's perfection isn't lived on the planet. This made sense to her. She's very religious.
Yeah.
And so she said, "Oh, so I'm interested."
Good answer.
No fair. That very good. Wes, did we get yours? Oh
Mhm.
no, wait. Yeah. Okay, and Sicha, you got your hand up.
Yeah. Yeah, I have to confess that I have slacked off for quite a few years, and I'm just wondering whether new this set of slides have also updated during this time. And as you know, in the past, we often try to convince people that, even though Canadian systems is not perfect, it is overwhelmingly favored by their people compared to people in this country. And to my dismay, in the last few weeks, I have had conversation with two Canadians, and both of them were quite disgruntled about the Canadian system. Uh, Again, because of the long wait, and I remember they used to have that problem, and then their finance got improved, and supposedly had a lot of infusion of money from a Japanese loan, and so I guess that's uh, surfacing again. And another system that we often related to is the national health uh, in England. And then, but recently in the articles that I saw, and even in New England Journal of Medicine, as I recall, they are in crisis. They're in crisis. So my really real interest is to get back to the talking to the young training physicians, and so I need to have a little bit of reassurance of what
What to do
system
it.
to encourage them with, yeah.
That's why Mary Lou has her hand up.
No, Mary Lou has her hand up because I was a little bit of that, but I was going to respond somewhat to Marissa Bell with a person saying that, people come to the United States. Well, an awful lot of people from the United States are going to Mexico and other countries to get their care because it's so expensive. So I mean, I have lots of friends who are taking trips for dental care, for all kinds of medical stuff outside the United States. So I think there's always a group of people who have the ability to travel to, get the best they think, and they go do that. But I think you're right. It's really about the system that we have now is unsustainable, so unaffordable, and that indeed, and around wait times, just ask people about how long have they tried lately to get an appointment with any kind of provider. But my daughter-in-law, for example, needed a dermatologist, and she's waiting 9 months to get an appointment. So I think that sometimes people they think it's easier here. They haven't really tried lately. So anyway, it's not perfect. I think your answer is it won't be perfect. But we're going to build it, and we're learning from all of these other places and trying to craft something that really, doesn't have some of the negative effects of others. But, we're building it, and we want people's input as to what's important to them. And that's why we're having these meetings, is to hear from people and to take this back to the various groups of the governing board and encouraging people to, that it's an open, transparent thing. And I think when Mike was asking earlier about how do we or Charlie, I guess, how do we get people to, pay attention and get involved and, all of this with the public corporation. And I guess, Charlie, my answer is there's a very small group of people around anything. I mean, look at the county commission, look at the city councils. It's a small group of people that pay any attention to the real governance of their communities. And we want to make it so that people have the opportunity and encourage them. But I guess I'm not of the belief that we're going to have gushing numbers of people who are going to spend their free time reacting to it. If they have a problem or something, we want them to know where they can go, how they can have redress. And I want it to be open, but I guess I'm just getting a little cynical about, the number of people, even with what's going on nationally. I talk to a lot of people and they're kind of just going, well, not much I can do. So I don't know, just my reality here.
Thanks, Mary Lou. Before Bruce and then Bruce, I just wanted to comment on the fact that Canada and the other systems actually have keep track of their wait times. In this country, we don't. So there's no way to measure people who never go in and don't even get in the queue. And I think people find out they wait longer here than in Canada. Before Bruce Deloria, I just want to introduce Bruce Thompson. He just joined us, retired family physician. And tell us a little bit about yourself, Bruce, and then we'll go to Bruce Deloria.
Yeah, well, sorry for being a little late. I was helping with dinner plans, so mostly doing the dishes. Any rate, yeah, so I'm a retired family practice doctor, a retired public health officer, and I've been working with the Mid-Valley Healthcare Advocates and HCAO for the last 10 or 12 years, I think, something along those lines. And we see little bits of progress. We all hope that there's more progress, that it's quicker, but this is social cultural change and it's going to take a while.
Well, thanks, Bruce. And Bruce Deloria, you had your hand up.
So just quickly, I've been looking for if I'm assuming something, and I'm trying to find out if this is really true. Is HCAO, it should also be working somehow towards, it's got to, improving the amount of caregivers and facilities, because there's going to be a lot more people in the receiving community. So of course we're going to need more hospitals, and we're going to need more health care people, doctors, from doctors down. In what ways is HCAO going to make it possible for those things to happen, both on the educational side and on the facility side?
So, Mary Lou, you might have the best answer.
Well, I guess I'm going to say I don't know that HCAO is really going to do that, honestly. I mean, maybe in our next phase of life, but I do think that the Health Plan Governing Board is really looking at those kinds of issues, and there's going to be a transition committee. Right now, there's an operations committee that'll talk about it's working on implementation issues, but the transition committee on really how are we going to do that, and the amount of money, and also the revenue committee and finance that Charlie sits on and has done the yeoman's work on that committee. People need to know, I think, that as much has been done has really been done by Charlie on his volunteer role. So But I think that and he's trying to get a handle on how much do we spend in all the nooks and crannies of healthcare right now, and how can we get our hands on it and corral it and use it in a much better way. But then I do think that Revenue and Finance Committee will be looking at money and needs and costs for expanding workforce for all the kinds of things you're talking about, Brian.
And hopefully bringing helping young people who want to be there to get
Yes,
into that workforce.
right. I think there's some efforts going on right now in Oregon. There's a workforce, commission or task force. There's a lot of things people are trying, especially behavioral health seems to be really looking at how do we get more behavioral health people and different levels of them. And it's complicated, but I think that definitely kind of back to what Mike was almost saying about, that we don't keep track of wait times in the US. Well, we don't keep track really well of kind of the workforce in toto and how many we need and how to fund it. And so I think having everybody under one tent where we can really say this is what the need is, we can see, and then we can work toward it. But it's not going to be perfect on day one.
Oh, thanks, Mary Lou. Wes.
Thank you. I really agree with what's being said. Thank you. I'm on the board of Healthcare for All Oregon. I think I told you that. And we are not a provider of services. We are a community organizing organization around our state. We've been around a long time. We have wonderful connections and pushing the governance board to do what they've been set out to do and to implement the study that was done. We go back years with this. And so locally, I wanted to say, we're going to have Sandra Coiner is going to be putting on a presentation for Healthcare for All Oregon's Rogue Valley chapter coming up here. The slides is what I'm talking about. And so I see using these slides with presentations about education, about the governance board, with a target on getting people involved, being involved. And that's how it's set out to do this thing. How are we going to get the public involved? That's what I want to do. And I think the slides will be a really good way, using them in a presentation to touch these other very important issues. Thank you.
Thanks, Wes. Charlie.
I wanted to touch on a few things that Mary said, kind of in response to Bruce, and that the state of Oregon or the Oregon state legislature is actually working hard to try to figure out how they can increase the workforce. I mean, it's been an ongoing effort. They haven't had that much success, but they are working on it. And one of the things HCAO does is support that effort and say, yes, we would like you to continue that and see what else we can do. So that I would say is more where HCAO has been on the workforce effort, is saying, yep, we agree with you. We need to do it, and let's see if we can do something. But it is really going to be up to the state legislature to do anything, because long before we get our plan in place, we need a bigger workforce. And most of the effort, as Mary Lou said, has been recently on behavioral and mental health, but it's across the board, and it needs to be across the board, and it needs to be done prior to when we get our plan in place. So
thanks, Charlie. Just as a comment on increasing workforce, the Lebanon campus of the osteopathic school has won national awards, high ratings for its training of primary care. And the statistics show that 70% of those graduates stay in primary care, and half of those stay in Oregon. So that's some encouragement. And we need to increase incentives for people to stay in Oregon. Other things I was thinking of is maybe we should just go through the slides. I just want to explain the slide set. And as you give these talks, I'm channeling Sandra Coiner right now, that it's not so much you want to have people come out of your meeting saying, gosh, that was interesting, or gosh, I'm glad I learned that. you want people to come out of the meeting saying, I really feel good about these people. These people I want to join. And the next step is we've got to have jobs for them. We got to be thinking ahead. People aren't going to just join and stay because they've signed a sheet of paper. We need to put them right to work. So that I know HCO has been working on jobs to put people into data management, speaking like we're doing here, um, art, messaging, all that. So if it seems appropriate, I'd like to go to look at the slides and have you think of this as a library, not as a
Mike,
slide. Yeah.
could I comment on workforce? This is Wes.
Oh, sure. Please do.
My union has tens of thousands of home care workers. This is a part of the workforce that's very important. And that workforce needs expanded. These workers doing this, these union workers, are getting training. They're bringing up the standards of what part of this workforce is all about. Nursing homes, we're just nibbling on that, but we need nursing home workforce. Workforce is what I'm trying to talk about, and I want to see us really concentrate on that. I want to see AFSCME's working on this. Other unions are looking at it too. I want to see when we talk about workforce, increasing the numbers of people in home care and in the care industry, nursing homes too. So that thank you for letting me say that because we got something working. We need to expand it. Thank you, Mike.
Good. All right. Thanks. Thanks, Wes. I'm going to share this slides now. And
While you're doing that, can I just say one thing, Mike, on that?
sure.
People need to be out at rallies and all. I was with SEIU here in Portland night before last, rallying to save Medicaid. If we have the kind of drastic national cuts that they're talking about in Medicaid, like a huge percentage of the people who are home care workers are being paid through Medicaid, through the Oregon Health Plan. And this is going to be disaster if those cuts go through. And I think we're working in a time, I feel somewhat like kind of crazy making where, on the national scene and all of this, things are, potentially really falling apart or have that real potential to be cut drastically. And then I'm working on the ideal plan for Oregon. And, that is based on the fact that we have Medicaid funding. So it's a little crazy making, but I think you have to kind of do both. And so we need to be defending the system that isn't as perfect as we'd like it to be, but at least it is there and funding home care and long-term care. But on the other hand, then once we've defended it, we need to improve it with our big plan that we're doing. So anyway, that's just get out and resist, guys.
Thanks, Mary Lou. The proverb is, of course, the crisis is opportunity.
Yeah.
And so you may have heard that the courts rejected the Department of, well, just call it Muskrat and Trump effort to basically dismantle Social Security. And the reason that has happened is the public outcry. It's been very loud in red and blue states. And we can make the same public outcry about the threats to Medicaid and Medicare. And that's one of the reasons we're here, is to be able to do it effectively.
Good.
And if you talk with a group and you get a question that you do not have an answer, more than just say, go to the website, it would be, please, we don't have time to get into that, but please give me your email and I will follow up with you. I know that sounds tedious, but to gain trust with your audience, you probably have to say that in order to keep going and keep your talk going. So should we look at the slides? Oh, yes, we are, aren't we? So there, I'm going to put it in the grid form here. You do that by going down here. Can you see this down here, this little grid view?
Uh-huh.
Click on that, and you can see the
Oh,
slide set
good.
pop up,
Mm-hmm.
and then you can kind of just sort through. And there are 53 slides that would form a cohesive talk, but you may get only 15 minutes and probably a max, and other speakers may say yes or no on this, is probably 2 slides per minute. So depending on who your audience is and how much time you have, you will have to carefully select from even this group of 53. Now, it's really not that many slides because some of these are duplicated so that you can put one idea up at a time. Let's say, let's go here and I'll put it on slideshow. And so as you go through, it allows you to say, here's what happened in Eugene in 2020, in Portland in 2021, and Corvallis in 2024. So you might consider that one slide, but um, then going on to the next, it would be what is the solution? And those are just individual, those are not multiple slides, but the idea is to consider this a library and just figure out who your audience is and how much time they're allowed to give you. So that's the 53 slides. And these, speaking of keeping them updated, I think maybe Bruce Deloria was saying, are we going to keep these current? And all these slides are primarily 2022 updated slides. And that's almost the most current you can get. So each slide, for example, if we can relate it to Oregon, that's the best. Some of it, we don't have stats for Oregon, but each slide has speaker's notes that you can choose from. And depending on the amount of time you have, just pick the comment that's most appropriate. And let's see, what date is this? This is 2020, 2023. Right here, you can see here. We try to have the references on each slide, even though they're not readable, like this down here. Can you see that?
Yes.
But they will be, well, usually they're repeated below. Let's see. Yeah, here you go. The reference is repeated down here. So if people ask, where'd you get that information? You can tell them.
Okay.
So beyond that, so if you use these, you should use the link because that's going to allow you to have the most updated set of slides. If you were to copy this set and keep it as your library, it will not be updated, obviously. So please remember to use the link. Now beyond this 53, okay, these are extra slides, and we'll be adding them over time. Some of these, like talking about values, there may be slides that you would come up with. In fact, this is part of the reason we meet is that you may have ideas that the graphics are better or the message is better under the category of values. And please send it to me or Sandra Coiner. There may be more slides appropriate under the category of equity or access or cost. And you can go through these and say, oh, well, this union audience or this particular church audience, this slide is going to be better than the one that's in that top list. So you just go through and shop. Does that all make sense?
Mm-hmm.
Any questions? Maybe I should go through one that it shows you how that it progresses. Okay, you're going to give people ideas on what to do. Time to go to work. Listen. That's probably the most important thing. Figure out what experience they've had with the healthcare system. and you may not even start the conversation, but well, you're giving a talk, you probably would start about healthcare and ask the group, just a few of them, just like we started this meeting, what's the most important thing you want to be that we address while we're together today? And listen and have somebody write those questions down, maybe just 3 or 4. Listen carefully. But if you're just one-on-one, even at the checkout county at the drugstore counter, I often ask, does your employer supply healthcare for you? Yes. Do you know what your deductible is? And often they don't know. And when they do know, it's $1,000 or it's $2,000. Well, does that allow you to go and get healthcare? And for some people, the deductible means they don't get care, even though they have insurance. So then this starts adding up, listen and then read or research, whatever you would prefer. And by the way, these are just placeholder kind of images. If you have images that you think might be better, particularly if they are photos of us rather than borrowed from Canva or stock photos, we want to get an image of the diversity that we have in Healthcare for All Oregon and people in action. So the next one is show up. You're going to listen, you're going to read, you're going to show up, and then speak up. That's just an example. And then this, you can have people point their cameras at to get right access to the Universal Healthcare Board. Any questions about that?
Mike, what is the link that you referred to that will lead to the slides?
It is in the, I believe I put it in the chat, but here, I'm going to show you what I'm going to do here. I'm going to share slides. So at the top of this set of slides, there's the URL here. Let's see, new slide library. Here's the URL. You copy that. And then I'm going to put it in the chat and you can try it. So it's in the chat now.
So, Mike, just to clarify, hopefully that I think I know what you're saying, that using the link is better because those Google Slides will be continuously updated
Right,
versus
right.
downloading a copy of them now and not getting an updated version. If you have a downloaded copy, it could get outdated pretty quickly.
Right, right. And we do want it to update it from input from you. If you see information that's newer than what we have, please send it in and we will update that slide. And whether it's better graphics or more current information. Any other thoughts? Yeah, Wes and then Bruce. It didn't unmute you yet. Go ahead, Bruce, and then Wes will come later.
So I think what keeps coming back to my mind is the question of where are we getting the news of what the governing board is doing, what decisions they've actually come up with, what's getting solved? Do we have a place where the up-to-date progress is there so we can answer some of these questions on details that I don't see answered?
Sure.
So Mary, yeah, go ahead, Mary Lou.
If you just Google Universal Healthcare Governance Board, it'll come to the the website. Go there, and everything is there. Every meeting is there. The agendas are there.
I'm talking about just the answers about how things are going to work. Not that reading through minutes
I know
is not going to do that.
We're in process. I don't know that it's decided exactly how it's going to work. It still is being designed. I guess that would be my thing. Charlie, do you agree with me that it's like, I don't think it's, yes,
Yes, I completely agree with you. No real decisions have been made, I would say, at this point. And so, but I mean, I could answer some of your questions, Bruce, which I was going to offer. I'll send you my email. So a few of the questions that you asked earlier, I could answer, but many of them I cannot. And for most of the things that I think you want to know is it hasn't been decided yet. The governance board is in the process, and as was sort of alluded to, it's taking longer than we would hope, and but not probably longer than we expect.
I'm sorry for
no, that's
Yeah,
okay. It's really quite
yeah,
complicated.
And do we
yes.
And there
do we
have
have a
been,
place where as things are actually finalized, people don't have to read through minutes and but they're enumerated in one place. Hey, these are the solutions we know.
The board has not done that. I think there's an effort being made by some people within HCAO, basically, who actually go through and review what happens at the meetings afterwards. There is sort of an effort to that, but there probably needs to be a little bit more. But I would say at this point, there's really nothing much to say.
Okay,
So
that was just a request.
unfortunately,
yeah,
yeah,
I guess
unfortunately.
the other thing is for people to know there are 4 committees. There's one that's looking at revenue and finance. How are we going to pay for this? How much is it going to cost us? And what kind of taxation or how are we going to do it? Okay. And Charlie's on that, and I'm going to be on that. Okay. So that's one. The other one that's, I think, of big interest is the, oh, help me, Charlie, with the name, but it's the benefits, what's covered.
Plan
Um,
design
Plan
and
Plan
benefits. Yeah,
design and benefits. And
yeah.
so that they're working and kind of just yesterday presented kind of a straw poll from their group that has not been finalized by the whole board yet, but saying it's basically going to be the better a better PEB, the state one that the state employs that the governor has, plus because the Oregon Health Plan has better mental health benefits than that, for example. So right now, the effort is to take the best out of all of these 2 plans and kind of merge them together, but it hasn't been finalized yet. And then we'll have to be taking a look at how much is that going to cost, because the plan that was, kind of presented yesterday, really, really comprehensive. And, at some point you're going to have to say, but I think that your Intel friend, you can say that we're looking at all of these various plans and wanting to have the best plan possible. And so that's what we're doing. But there's that. Then there's the Community Engagement Committee, and it is talking about things like we're doing here, how to, but in the law, it prescribes certain groups that have to be engaged and talked to. And that's who they're going to focus on. They're going to focus on providers. They're going to focus on insurers. They're going to focus on, help me here, Charlie, but the groups that really, not so much the general public. I think what HCAO is trying to do is get out to the real communities, the general public. But the community engagement group, the law specified about 6 groups, disabled, that really have to be engaged. So those are 3 of the 4 committees, and the 4th committee, operations. And that's the one that Dr. Bruce Goldberg is chairing. And it's looking at things about the public corporation, about, how is this thing going to really, really work? So those are the 4 committees. And we're going to have at the next board meeting a review of the work plan that they set out for themselves when they began. I just joined this month, so I feel like I'm coming in the middle of the movie. But they set out a work plan, and so the next month is going to be really going through that work plan and looking at where are we at, where aren't we at. And so I think that's going to be a big one. And hopefully right after that, maybe we'll get a little bit more. And I think the other thing that I'll take back to Rebecca Schoon, who I don't know if everybody here knows who Rebecca is, but she's a professor at Pacific University and teaches global health, et cetera, and public health. and she's chair of the communications committee now at HCAO, and she's really excellent. And so I think she's working on our messaging. And I think, maybe what we should do, and I'm going to tell her this after this discussion, is have, kind of monthly FQH facts or questions or what's been decided so far or something like that, and put it on our website so that we can say, it's not done, it's a work in progress, but if you want to see kind of the decisions so far or the things they're leaning towards so far, maybe that could be,
Thank you. I think that would be helpful.
Yeah. So I will add a little bit. So there are a few questions that can be answered that Bruce had asked earlier. One is who is going to appoint members of the board? And the
Yes.
governor, I mean, if it's a public corporation, which is what the law said it's going to be the governor will appoint them with confirmation from the Senate. So that's how the members of the board of a public corporation in Oregon are appointed. So that is almost surely going to be what it is. I don't think they're going to change that because that's kind of what the law says they're supposed to do. And then another question that came up was, now I lost it.
That happens.
Yeah, about insurance companies. So private, almost surely the way it's going to go is that private insurance companies will not be permitted to cover things that are covered by the plan, sell policies that cover things that are covered by the plan, but they will almost surely be able to cover anything that is not covered by the plan. So you can't imagine that it's not going to go that way. I'm almost positive that's what they're going to decide to do. So
and that's pretty much
those
what the
questions
law
that can be
said.
answered.
Yeah.
Are there going to be many things that are not covered by the plan?
That is a good question. The hope of many of us is no, there's not. So there's going to be almost no reason for insurance companies, but we don't know that yet. And part of it will be, it's going to. So going back to another thing that Mary Lou said, one of the things that the Finance and Revenue Committee is pushing for is a lot of just general public engagement on the finance plan itself, on the tax structure itself, so we can get lots of input on that before we put it out for a vote and say, well, is this, this is a possibility. Does this look fair enough to you? Does this make sense to you? If not, what would you change? And depending upon how that goes, it might be, oh no, it's got to be a lot less money. Well, if it's a lot less money, then less things would be covered. Well, if less things are covered, then we'd save less money overall in the system. So there's all sorts of things that are going to come into play in there. But yes, the hope is an awful lot of things will be covered, almost anything that most people would need. So, but we don't know.
So you'll have to wait with everybody else for that thing that's covered for everyone. And that's where there's always going to be those wealthy, special, entitled people that are not going to vote for it because
exactly.
They're entitled after all.
Exactly. They can go to Mexico. They can fly off to Switzerland. They can do what they want to do.
They can go to almost any other state in the nation.
That's true.
So to honor the electronic hand raising, thank you to Hannah.
Yes.
You're up.
Yeah, so it seems to me like at this point in time, because we don't have a lot of answers about what exactly this is going to look like. Although, there's a lot of questions that when you bring this topic up, I mean, I've also had the experience of telling people about what I've been working on with HCAO, and they're like, one of the first questions is like, how are you going to pay for that? It's a common refrain that we've all heard. And so since, these are the kinds of questions that people are asking, but we don't really have answers to them yet, it seems to me like the structure and goal of at least these initial early on community conversations is really around asking the audience to dream up what they think, the perfect plan would be. Like, I see this as an opportunity to get people to think big. And so I really like that in the slides kind of lead with some slides about values. And I think that and I wanted to get people's input on this. I think that if I were going to set out to do one of these, which I may actually be doing one at the end of April, um, I think the way I want to go about it is I want to ask people. I want to get people in like small groups, if it's, a large enough group of people, and get people to actually talk to each other and come up with the values that they hold around healthcare. Like, what are your values around healthcare? What do you think is important? And like hone in on those and then maybe share back with the greater group and kind of see where we're in alignment as a group. And I feel like that's a really, um, you know, sort of powerful way to illustrate to people. First of all, it brings to mind for them all of the things that are broken in our current system and like how they wish it was different. And then second, to like think positively and hopefully about the way it could be, which, can then kind of lead into, out of that, you can get into the conversations about like, yeah, this probably shouldn't be for profit. When this is profit, when there's a profit motive, we're not actually getting the care that we need and deserve. And I would bet money that probably most people in the audience, save people that are working for, healthcare insurance companies, are going to be in agreement with that. That like, yeah, pulling profit out of this is probably a good idea and will be better for everybody. So kind of like, I see it as an opportunity to sort of hone in on what people's values are and find common ground there, which I believe is going to lead all of us to seeing that like, oh yeah, okay, building a different system from the ground up that is fundamentally different than our current system is better and will be pushing us in the right direction. Does that seem like a good idea?
One thing I would add to that, if Mike, can I go or do you want to go? I can't hear you, Mike.
Go ahead. Yeah.
Okay. If you Senate Bill 1089 created the governance board, but that has been codified into Oregon statute. And so Oregon laws are called ORS with a number, the Oregon Revised Statutes. Okay. If you go and just Google ORS 751, that is where this law is. And in it, it lists the values and the principles that the board is working from. And so you might even look at what those are and pull them out and see whether people agree with those values or if they've got anything different or something. But I think we need to keep going back to, there's the task force that worked on this whole thing. There's also, and that is on our website, the summary as well as the task force report, so that if you really kind of want to know some of how all that came about, but the law actually says these are the values and the principles that whatever's created by this board, it's got to meet those. And those are the kinds of things that you're talking about. And so I just would encourage you also to take a look at those. And
Excellent.
It's ORS 751.
Yeah, I wrote that down. Yeah, I could imagine, having people kind of report to the group what those values are and then pulling them up and saying like, well,
Yes.
these are the ones
These
that,
are
we
there they are.
identified. And like,
Yeah.
look, a lot of the ones you identified are on here
Are
as
right
well.
here.
And
They
yeah.
will be. And one of the things, I was back at the beginning where we started Care Oregon. And when we started it, it was a partnership between Oregon Health Sciences University, federally qualified health centers around the state, and Multnomah County, and very different providers of care, from the OHSU down to little teeny federally qualified health center in Klamath Falls. And you can imagine when we got people together to talk about what we were going to do here and creating this Care Oregon thing, that people, they all looked at each other with great suspicion, sitting across the table, like, oh, those people from the Hill, oh, those people out in that poor people's clinic, oh, this kind of thing. And honestly, the two people, me and the guy from OHSU, Jim Walker, didn't know what to do with the first meeting. And so what we decided to do was ask people about values. And we wrote them up on, one of those poster board things. And we continued to use, and what we found was that it brought the table together. they found, oh, the
Mhm.
Multnomah County people found that OHSU people had the same values, and those people in the federal, so it was like the thing that was like, oh, we're not that different. And then over time, we continued to use those values when we'd be stuck on designing something, because Care Oregon didn't exist. We just made it up. And so we had to
Mhm.
figure these things out. And there'd be arguments over, where do you spend the money? Is it on primary care? Is it on hospital care? And proportionality. And we would go back to the values
Mhm.
that had been said, that we wanted to stress prevention. Oh, well, then I guess we shouldn't give all the money to the hospital, and
Mhm.
it rescued us a lot. So I'm just really
That's
going with
awesome.
you that values do help, and they bring people together.
Yeah. Thank you.
We're right. Thanks, Mary Lou. We're right at 7:02, and in honor of everybody's time on a Friday night, it looks like we'll need to get to logistics at a future meeting, and I'm happy to go over that for anybody who was willing. Do you want to meet again in a week? I'm going to have surgery on April 8th, cervical spine surgery for cord compression. So if we want to meet again before then, it would be a week probably, and talk about logistics. I did put a link in the chat to give you an expert's view on you can speak in public. And this is by Ed Weisbart, who's sort of the prime speaker for Physicians for National Health Program. It's wonderful. So that link is in the chat for you to look at when you need time. And then just going back to starting with values, forever we've started our talks with the problems, and we realize now that there's a couple problems with that. It makes the audience feel that we're unpatriotic, for one thing, and it focuses on the wrong thing. And so we're glad to see that now we're starting with values. And we have two studies, as you know, in the slide set that support that. The Oregon Health Hub report that we heard last June, and Warren George's Elway Institute study focusing on values. So we should need to bring this to a close, but Charlie.
So I wanted to add to a little bit of what Mary said relating to values and principles. There's also one other portion um, of the law and also Senate Bill 1089 that isn't called values or principles, but is sometimes called objectives, but is essentially the same sort of thing. And it includes some of the most important, in my mind, values and principles. So when you're looking at that, you want to make sure you're looking at that as well. And that's essentially 751.0022. But if you look up objectives, I think you will find where it is. So values, principles, and objectives, because those are really in there appropriately as well.
So
one last plug for this little card.
Mm.
These are going to be coming out to all of the chapters and become available. We're getting them reprinted right now. This was kind of a quick thing that we did, and are not, making a couple changes. But basically it has, how to get a hold of everybody, etc. But then inside, it's got this thing like, imagine all these things that could be if we had a new system. And then over here, a quick little laundry list of the steps, we talk about people who've been working on this for 10 years or more, that kind of what has been accomplished and kind of where we are in this timeline, to make people feel like, oh, we're way down here. We're going to be reporting in 2027. The legislature is going to either act on this or refer it out to the voters. And the voters are going to have a chance, maybe. Okay. And then a little thing on the back where they can get more information. So I think they're nifty. And also you can put your contact information. We're just revising for a few more lines, so it's a little more room. So you can personalize them and give them to people. And if they want more information, they can email you or something like that. So anyway, I think we've been trying them out. People have really liked them. And just today we did a little modification, getting ready to go to print. So these should be coming out pretty soon. And I think for any kind of talk that I'd be giving, I would be having these available for people to take with them.
So
Okay.
thanks, Mary Lou.